Today, we're going to take a detailed look at how your feet can give you important clues about the health of your liver. Before we get started, let me make something very clear. These are not diagnostic tools. In other words, you cannot officially diagnose a liver disease just by looking at your feet. For a proper diagnosis, you must consult a medical professional and undergo the right tests. However, what we are going to discuss today are valuable warning signs clues that can help you narrow things down and better understand what might be going on inside your body. With that in mind, let's dive into the fascinating connection between your feet and your liver. One of the first things to notice is the appearance of small red or brown spots on the lower legs and feet. These can be tiny specks or slightly larger patches, and they sometimes even have a shiny texture. Such discoloration often points toward poor circulation. Poor circulation can be the result of many things, but liver problems are a common cause. It can also relate to diabetes or other vascular issues. The reason circulation shows up in the legs and feet is simple. Your heart has to pump blood all the way down to your feet and then bring it back up again through the veins. When the liver isn't working properly, or if there is heart stress, circulation is compromised, and the effects show up in the furthest parts of the body, the legs and feet. This is why the lower extremities often reveal early warning signs of liver problems. Along with spots, you might notice spider veins, also called spider nevus. These are small, thin veins that spread out like a web under the skin. Spider veins are frequently seen in cases of liver cirrhosis. Why? Because when the liver is damaged, it often leads to a buildup of estrogen in the body. Too much estrogen affects the vascular system, making the veins more visible and more fragile. Varicose veins and spider veins in the lower legs, therefore, can be another visual clue that the liver is under stress. Now let's talk about cracked heels. Many people think cracked heels are simply a matter of dry skin or poor footwear, but in reality, they can also be a signal of nutrient deficiencies. Most often, this is linked to a deficiency in vitamin B3 or omega-3 fatty acids. The liver is responsible for producing bile, and bile is necessary for absorbing fats and fat-soluble vitamins like A, D, E, and K. When the liver isn't functioning properly, your body doesn't absorb these nutrients efficiently, and the skin begins to suffer. Vitamin B3 deficiency, known as pellagra, is well documented for causing severe skin issues. So cracked heels may not just be a cosmetic problem. They can actually reveal deeper issues connected to liver health and nutrient absorption. Another important sign to pay attention to is itching in the feet, especially on the soles. Persistent itching can be the result of bile backing up in the liver. This condition creates a buildup of histamines, which trigger itching sensations. Some people might mistake the pain and inflammation at the bottom of the feet for plantar fasciitis, but in many cases, it's not really a ligament issue, it's a sign of liver congestion. If you've experienced ongoing itching, burning, or inflammation in the soles of your feet, it could be pointing to liver stress. Similarly, hot feet, a constant sensation of heat in the feet, can also be connected to liver dysfunction. Now let's consider another often overlooked sign: foot odor. Smelly feet are not always about hygiene. They can also point toward a liver that is struggling to detoxify the body properly. When the liver becomes overwhelmed, toxins don't get filtered out as they should. Instead, they begin to back up in the body and find their way out through the skin. When this happens, unpleasant odors can develop. Usually, this is combined with poor overall diet and lifestyle, where not only the liver but also the kidneys and large intestine are congested and overworked. Remember, if one detox organ is in trouble, the others are often affected as well. Pitting edema is another classic sign linked to liver problems. This is when you press your finger into the lower leg or ankle, and a dent remains in the skin for a while instead of bouncing back immediately. This happens because of fluid retention, which is commonly seen in liver disease. When the liver is unable to manage fluids and proteins properly, fluid builds up in the tissues, especially in the legs and feet. Toenail fungus is another signal worth mentioning. People with liver problems often experience a higher level of fungal growth on the body. This is because liver dysfunction disrupts the natural balance of microflora in the gut. An unhealthy gut environment often leads to an overgrowth of fungus and yeast, which can then appear on the skin, scalp, and nails. That's why conditions like dandruff, psoriasis, or fungal toenail infections are frequently seen in individuals with poor liver health. Another related sign is the change in the nail bed itself. Normally, your nails should have a small half-moon shape near the cuticle known as the lunula. In people with circulation issues tied to liver problems, this lunula often fades or disappears, leaving the nail beds looking unusually white. So now the big question, what actually causes liver problems? There are many possible reasons. One major factor is side effects from medications. Many drugs put a heavy burden on the liver because it has to process them. Another big cause is high sugar intake, especially from high fructose corn syrup found in sodas, sweets, and processed foods. Eating mostly cooked or canned foods without fresh vegetables is also damaging, since it deprives the body of enzymes and antioxidants that protect the liver. Junk food only adds to the problem. Excessive alcohol consumption is a well-known cause of liver disease. And finally, consuming too much protein, especially in the form of shakes or large portions, can overload the liver and kidneys with nitrogen waste, making them work much harder than they should. If you already have signs of liver stress, it's important to adjust your diet. Reducing protein to a moderate level while significantly increasing vegetable intake is a great start. Vegetables provide antioxidants, enzymes, and fiber that ease the workload of the liver. At the same time, cutting back on sugar, processed foods, and alcohol is essential. A clean diet rich in whole natural foods supports the liver's ability to regenerate and keep the rest of the body healthy. In summary, your feet can give you incredible insight into your liver health. Red or brown spots, spider veins, cracked heels, itching, hot feet, bad odors, fluid retention, nail fungus, and white nail beds are all signs that something deeper may be going on. By paying attention to these early warning signs and making lifestyle changes, especially in your diet, you can take better care of your liver and your overall well-being. Remember, your liver is one of the most important organs in your body, and supporting it will benefit your entire health.